The Emergency Medical Services Task Force, created by the legislature during the 2023 session, held its first meeting in December, followed by field hearings around Minnesota. A final report is due to the legislature by mid-August. Meanwhile, the situation is dire, and some recommendations will likely receive consideration this session. Joining me is the co-chair of the task force, Senator Judy Seeberger. Thank you for being here.
Thank you for having me.
Field hearings were held in Winona, Mankato, Elbow Lake, and Mountain Iron. Were there common threads, or are the challenges different depending on the different regions?
The common threads that we saw with regard to EMS delivery in the state of Minnesota are very similar from region to region, according to what we heard when we were on these field hearings. A couple different issues. Number one, workforce challenges, having problems with recruitment and retention of qualified EMTs and paramedics. Reimbursement rates are an issue. When you have a population that is largely a Medicare population, your reimbursement rates are going to be lower. The other issue is ambulances generally are only paid for their runs if they transport the patient. So if we go out and we provide care or an assessment of a patient but don't transport, no revenue is generated from that run. Those were a few of the issues that we heard. Part of it also had to do with the greater Minnesota response times and assembling personnel from volunteer services. So common issues, maybe different reasons for the issues, but there were common threads.
There was a press conference last week that was promoting a bill carried in the Senate by Grant Housechild. It has bipartisan support, and it would provide $120 million in emergency funding to prop up EMS and ambulance services. In your view, is emergency funding necessary right now?
I think Senator Houschild's bill really highlights the issue that we're seeing in greater Minnesota. We're seeing towns and ambulance services throughout Senator Houschild's district that they're losing money, and they're losing an astonishing amount of money due to low reimbursement rates and other reasons. So his bill really highlights the need in greater Minnesota. I think that is an area that needs immediate attention, and whether it's through Senator Houschild's bill or some other relief, I think that's something that we're focusing on right now this session so that we can deliver some aid to his region.
Well, and to further that point, Senator Housechild represents a very large and sparsely populated rural district in northern Minnesota. And he called the discrepancies in funding an equity issue because some areas of the state do have positive balance sheets for their EMS and ambulance services, and other states or other areas of the state, as you said, are really struggling financially. Is it an equity issue?
I think it can be viewed that way. I think Senator Housechild has a point. When you look at his area, which is geographically enormous, and the run volume and call volume in his area versus down in the metro, there's no comparison. It really is it's a numbers game, right? So the more runs that you have, the greater your revenue is going to be. When you only have a few runs a year, you're going to experience those losses at a much more dramatic rate.
According to the National Conference of State Legislatures, or as people around here say, NCSL, 13 states and the District of Columbia have passed laws that make EMS an essential service. Minnesota is not among those states. Should Minnesota make EMS an essential service?
I believe that we should. I think people are surprised to learn that it's not. When you call 911, your expectation is you're going to have help when you need it. And people, when they call 911, they're having one of the worst days of their life. And it's been my honor as a paramedic to be there for people when they need us. I think it absolutely should be an essential service. Now, what comes with that is how do we fund it? So that's something that Representative Hewitt and I have been really working on. We're not there yet. We don't have the answer, but we're exploring a lot of different options to ensure that we can fund it when we do make it an essential service.
And one of the recommendations that you have is to develop what you've called a sprint medic model. What do you mean, and how would this help?
So if you look at it, again, I'm looking at Senator Houschild's area again for an example. They survive mostly on a volunteer model where when the tones go off, when a call comes in, the tones go off, and then people come from wherever they are to get to the fire station or the ambulance station, staff the ambulance, go out to the call. And that takes time. If we have a sprint medic or a paramedic, which is a higher level of care than an EMT, if we have a paramedic full-time at the ready who, when the call comes in, can go directly to the scene and start providing ALS care, advanced life-saving services care, a higher level of care until the BLS truck or the EMTs arrive, that patient has a better chance of survival. On the converse, if the paramedic gets out to the scene and they determine that the patient doesn't need a transport, doesn't need to go in, they can cancel the ambulance, and then that frees up that crew for another call and relieves some of the burden and the stress off of them. So that's the sprint medic model in a nutshell, and I think that it would really benefit those in Senator Hochschild's district, those in Senator Rasmussen's district, and other areas where they really rely on the volunteer BLS model.
And along with that, you also mentioned during a task force meeting that there should be an expansion of community paramedicine. What does that mean?
So our community paramedic program is a really neat program here in the state of Minnesota, and what that is they're specially trained paramedics. So they're paramedics that have experience out in the field. They've got a few years under their belt. They receive additional training, and they're actually able to go into people's homes and provide some level of care. And the reason why I'm interested in expanding our community paramedic model is because we see a lot of EMS calls for things that are not an emergency, but people still need some level of care. And if we can address some of those problems upstream, if we can send a community paramedic out to help this person who really just needs an appointment with their primary care physician, maybe they take a set of vitals, help them set up their primary care appointment, help arrange transportation, that will take some of the burden off of the ambulance services and provide better care to people out in the community.
Finally, what about volunteerism? Because historically, the delivery of EMS and ambulance services has relied heavily on the work of volunteers, but burnout, stress, and other factors are contributing to the decline. Representative Jeff Becker, a Republican from Browns Valley, suggested incentivizing businesses to encourage their own employees to become volunteers. Could that help, or anything else? Do we need to keep volunteerism as a part of this model?
Volunteerism has played such an important part in sustaining our EMS services throughout the state of Minnesota. The volunteer model really subsidizes the entire industry with all the, I don't want to say free work, but volunteer hours that are provided by folks on paid on-call services, and I'm one of them. We provide that value, that readiness at a no-cost or low-cost basis to our services. Representative Becker's idea, I think, is a good one. I don't know that it'll get us all the way there. If you have a workforce shortage to begin with, and then you're asking people to volunteer time to do this kind of a thing, I think it's really hard to find enough people to continue to sustain this model, but it's something that we've been looking at with the task force also.
Well, we will keep watching and wait for that report to come out. Senator Judy Seeberger, thank you.
Thank you.